Hi, I'm James, a knee, foot and ankle specialist, and today we're going to talk you through the top 5 mistakes that people make after a knee replacement. Please remember, all content within this video is for educational purposes only and shouldn't substitute medical advice. So the first tip that we're going to talk through is about people not being prepared enough for your limitations post-surgery. So the things that you need to think about are that you're not very mobile post-surgery. So do you have someone at home to help you? Do you have access to your bed? Will you be able to tackle the stairs? Is there a possibility to put your bed on a lower level if it's normally upstairs? Do you have someone that might be able to assist with cooking for you? As sometimes the pain afterwards make it too difficult to stand for prolonged periods of time, which won't allow you to cook. And it's also worth considering how you're going to get to and from your follow-up appointments with your consultant and also with your physical therapist. It's also worth thinking about how are you going to get in and out of your shower or your bath after your surgery. So think about things like putting in a non-slip mat or putting in a stool to sit on so that you can comfortably wash yourself without putting excess stress on that new knee. The second mistake that people make after surgery is not taking their medication regularly. So it's often undervalued how painful it can be after you have a knee replacement. It differs from a total hip replacement. Those tend to go a lot more smoothly, whereas a total knee replacement is often more painful and you're less mobile afterwards. It's for that reason that your consultant often prescribes you some pain relief and some anti-inflammatories. It's okay to take these consistently, and in terms of rehabilitation, what we often discuss with our patients is that you're better at managing your pain levels with medication, so that facilitates your rehab rather than being in too much pain and not being able to continue with your rehabilitation. Another factor of taking medication consistently is that it impacts your sleep, and we know that sleep is one of the most vital aspects of recovery from a total knee replacement. So if you take your medication consistently as guided by your doctor, it means that you can get a smoother sleep that affects the pain levels in your body, helps to drop them down, facilitates your recovery and enables your rehabilitation. The third mistake that we see patients make when it comes to recovery from their total knee replacement is that they avoid movement because they're afraid of pain. They end up in a vicious cycle where they're afraid to move, therefore the joint becomes stiffer, the swelling remains, and they struggle to make progress. It's important to follow the guidance of your physical therapist or physiotherapist to do exercise little and often and keep the knee moving. That helps control your pain levels, helps reduce your swelling and enables your recovery. So while it can be scary to get moving because you feel like it might cause increased pain, if you do it regularly and consistently under the guidance of a healthcare professional, we're sure that will improve. The fourth mistake that we see with total knee replacements, especially in the younger adult, is the opposite of the third point, in that they try to do too much too soon. In these cases, what people tend to do is they try to do increased cardiovascular exercise, so they might push themselves too hard on the bike, they might try and walk for too long, or they might try and do too much in the pool. That can increase the swelling within the knee. This results in increased pain, and then they have to dramatically reduce the amount of activity levels to allow the swelling to reduce and the pain levels to decrease. These peaks and troughs of activity levels can really hinder your rehabilitation and slow down the process. So little and often, don't be afraid to move, but don't overdo it. The fifth mistake that we see our patients make with total knee replacements is that they don't do the pre-rehabilitation. This is really important. We know that the stronger your leg is going in before the surgery, the better your outcomes are afterwards. So think about strengthening your quadriceps, your hamstrings, your calf muscles, increasing your cardiovascular fitness. If you have a high BMI, trying to reduce your weight overall, that reduces the pressure that's placed on your knee, and that really enables a nice smooth recovery post-operatively. So there are 5 key mistakes that we often see patients make in our clinics. If you can try and address these both before surgery and after surgery, we're sure it will help enable a smoother recovery. If you've got any questions, please leave them in the comment section below, and if you found the video helpful, please like and subscribe to our channel.